For over 50 years, Mercy Foundation has been improving the lives in our community through wellness and prevention initiatives, mainly with our youth. The success of these programs and the experience gained along the way has laid the foundation for the expansion of these programs to serve others in our community in the form of 2 new projects.
These 2 projects are the launching pad for healthcare disparities. And you're probably going, what is a healthcare disparities? And basically, it is an opportunity for us to address some things that deal with the social determinants of health. And in these 2 scenarios, one is dental care and the other is food insecurity. As you know, over the years, we have had our Healthy Kids Outreach Program, school-based dental clinics. 5 years ago, I was very concerned that, yes, we're doing all this great work with our kiddos, but what happens when we have a patient that comes into the hospital? So it just seemed like a natural evolution or a launching pad to begin our inpatient dental program.
My name is Jenny Hensley, and I'm an expanded practice dental hygienist. And what that means at the hospital is I am able to go into rooms and provide services like provide silver diamine fluoride for tooth decay, fluoride to help remineralize enamel. I do toothbrush cleanings and oral cancer screenings for patients without the supervision of a dentist here at the facility. The reason why this program has been so important to me is because I care so much about my community, and I want to make sure that our community is healthy. And with the mouth being the mirror to one's overall self, we have to really focus on oral care to impact overall care. We've had patients who I found dental abscesses on right before they're getting ready to go into surgery, which it can impact them negatively. So we're able to get them on antibiotics and get that infection cleared up before we do their surgeries. Health disparities is something that's very important to me, and trying to help patients bridge that gap to be able to get to providers and to get the care that they need.
We started this back in early 2023. It's taken off so much that we had an opportunity to improve the dental care of our veterans with a huge grant from CareQuest.
A program like this will only work if all of us can work together in helping our community.
Even through the Healthy Kids Outreach Program, our nurse health resources, that too has been an opportunity, a springboard, to go ahead and launch our food closet program. We really needed to figure out how can we reach the patient before they leave the hospital.
The food pantry closet was created to provide food insecure patients at the hospital food to go home with, to really have a successful recovery from the hospital.
With help from generous donors, Mercy Foundation provides the initial funding backbone for these programs, but community partners are the key to making the programs run smoothly. During hospital intake, if a patient is flagged as being food insecure, a community health worker from Evergreen Family Medicine is notified and works closely with hospital staff to identify the patient's specific dietary needs or restrictions. Over at UCC, the Friendly Kitchen prepares thousands of nutritious entrees that are then packaged and frozen, making for convenient, cost-effective, and delicious meals. These dishes meet or exceed USDA nutritional guidelines for people over 60. Meanwhile, OSU Extension is busy readying Food Hero cooking kits, a bag full of useful kitchen items such as spices, measuring cups, tools, and recipes given to each patient to reinforce healthy cooking habits at home. Working closely with SHRMS, OSU Extension also stocks the food closet located at the hospital with healthy ingredients for the recipes found in the cooking kits. The food items and cooking kits are then delivered by the community health worker to the patient as close to discharge as possible.
It really does take a village to get all these parts moving at the same time for the betterment of our community residents.
With this program, we're really taking one additional stress off of patients in that they know they have the food that they need.
And now that these two programs have been highlighted for Joint Commission, we have goals, matrix that we have to meet.
The Joint Commission is a nonprofit agency that provides accreditation for hospitals who want to improve and maintain their quality programs and their focus on patient safety. We're very focused on providing the highest quality of care and the highest level of patient safety for our patients as possible.
One of the number one things that we look at are readmissions. Are our patients being readmitted for chronic disease that might be associated with poor dental care or poor nutritional needs that our patients might have?
We really want people to stay home. As much as we like to have business, we want our community healthy. So it's not just about the hospital, it's about strengthening the community overall.
So I've had three great mentors in my life. One, many of you know, was Sister Jaquetta Taylor. Second, Fred Sohn. And lastly, Dr. Paul Crimser. And each one of them always inspired me to do the right thing. Our mantra has always been every kid counts. We've expanded that now where every person counts. And we have to do the right thing to ensure that our community is healthy and that they are getting the best resources they can, whether it's through the foundation or through Mercy Medical Center.